Having the opportunity to complete a Pediatric Surgical Fellowship at Texas Children's Hospital is a once-in-a-lifetime opportunity. It is a year of substantial growth as a person, but more importantly, as a pediatric advanced practice provider. The day in the life of a PA fellow typically starts at morning rounds, exchanging patient care information and obtaining updates from the previous night to help provide children with the best medical care possible.
Surgery, and certainly pediatric surgery, is not thoroughly covered in most PA schools. We thought it would be a wonderful opportunity to take PA graduates and expose them to the broad diversity of pediatric surgery that exists here.
After morning rounds every week, the entire surgical team gathers in surgical grand rounds to listen to various lectures from presenters all over the world. These lectures include an extensive range of topics, including how to treat pediatric moi disease, tips on leadership development, and even advice on financial planning. These presentations not only enrich our medical knowledge, but help build our leadership skills.
I think seeing the longevity of this program, one of the things that I'm most proud of is to see some of the early PA graduating fellows now in leadership positions to take not only their clinical skills and to continue to develop them, but the organization has realized their value not only from a clinical standpoint, but from an overall leadership positions too.
I think the biggest thing I took away is how well prepared I was for the rest of my career compared to my peers. This program will help establish your career. It'll help you thrive clinically, grow in research, and give you opportunity to participate in events that will help build character, such as community outreach and educating patients and families, all while rotating through multiple surgical subspecialties that will help discover what your interests are and decide how you want to practice.
One of the best aspects of this fellowship is being able to care for patients throughout their entire surgical process. From their initial clinical visit to their surgery and post-operative care, PA surgical fellows are with patients throughout their entire journey. Here at Texas Children's Hospital, there are approximately 40,000 surgeries performed every year. As a PA fellow, we have the opportunity to assist in several of these operations every day. Depending on the surgical subspecialty we are rotating with, PA fellows may help with anything from an appendectomy to a frontoorbital advancement to a Norwood procedure. To be involved in this part of the surgical process is a privilege.
Do we want to go back to Dad?
Probably the thing that sets it apart is the volume of patients that we have coming through here, both the clinic and through the operating rooms. Nobody even comes close to 40,000 surgeries a year across every possible subspecialty, from neurosurgery to cardiac surgery to plastic surgery. We cover everything here.
When PA fellows aren't covering in the inpatient floors or helping in the operating room, our responsibility is to cover the outpatient clinics. We also perform a multitude of procedures, from suture removals to G-tube changes and joint injections.
My favorite part of the fellowship was the experiences I had. I was given many opportunities that PAs never receive. I was able to first assist in a transplantation. I was able to follow a patient through multiple surgical subspecialties. And I was able to work with and learn from world-renowned experts in every surgical subspecialty.
So every Thursday, PA fellows participate in a wide variety of lectures, followed by simulations and labs. These labs include casting and splinting, reviewing anatomy in the cadaver lab, participating in suture workshops, reviewing how to perform lumbar drains, and even peripheral IVs. All of the PA fellows are required to complete at least a minimum of 40 hours community service a year, and it's been my absolute favorite part of the fellowship. So this year we've done a whole bunch of community service, including the Family Fun Run at our West and Woodlands locations. We've done the annual backpack drive, as well as the Liver Life Walk and Cystic Fibrosis Run. Outside of the time we spend at Texas Children's Hospital, the PA fellows really do try to find a work-life balance by exploring Houston and the surrounding areas together. Every month we get together and do a PA fellowship dinner where we try different restaurants and activities, such as going to the rodeo or Astros games. This gives us time to decompress and bond as a group and enjoy the unique culture and atmosphere that Houston has to offer.
I think the direction of not only our fellowship program, but all fellowship programs is to continue to develop our profession. How can we be successful in training and developing subspecialty trained PAs so that at the end of their fellowship year, they come out and say, this was of value to me.
For more information on our PA Fellowship at Texas Children's Hospital, visit www.texaschildrens.org.